My name's Susan Buchanan. I'm the director of the Great Lakes Center for Occupational Health and Safety here at UIC, and we're one of the sponsors of this awesome event today. And the other sponsor is the Student Alliance for Public Health and the Environment here at UIC. So, welcome to everybody. I highly recommend the rosemary popcorn. It's unbelievable. I gotta go home and make some. But we've put together a panel that I'm really looking forward to hearing from today so that we can all appreciate better the effects of the environment on workers. We know that workers are often thought of last when we think about not only climate change, but any environmental disasters or other environmental exposures. And they're often the ones that are exposed to the highest levels and the most of the whatever is the hazard. So let's start with some introductions. If you could please, we'll just go down our panel and give us your name and the organization you're from, and feel free to, 2 to 3 sentences about what your organization does.
Okay, starting with me.
Sorry, you know what? I'm sorry to interrupt you. Say that we don't have mics. So if you could speak up, there's one here. So if people have trouble hearing, raise your hand and we could have the panelists come up and use this mic. All right, sorry. Go ahead.
No worries. So my name's Virginia Miller. I'm a full-time volunteer organizer, the operations manager of Midwest Workers Association, which is an all-volunteer organizing drive of low-paid workers like service workers, domestic workers, temporary workers, and others who are low income. And our office is down at 52nd and Halstead, and since 1996 we've been organizing on a totally independent basis to unite people from all walks of life to end the poverty conditions of our members. And we're here in part today because our members have endorsed the 2030 Agenda for Sustainable Development, or the Sustainable Development Goals, and are fighting for everything from an end to poverty to combating climate change now, and see the need to unite with others to do that.
My name is Elena Grossman. I am the program director for BRACE, Illinois. BRACE stands for Building Resilience Against Climate Effects. It's housed here in the School of Public Health. We work directly with the Illinois Department of Public Health to better prepare the state for the health effects from climate change. So everything from heat-related illness to vector-borne diseases, waterborne diseases, mental health problems, and respiratory health.
Hey everyone, I'm Theresa Yoon. I'm with SEIU Local 1. SEIU stands for the Service Employees International Union. We are a union of a little over 50,000 members, majority of which are based in Chicago, but we also have members in 10 cities throughout the Midwest. And we organize similarly like low-wage workers, service workers, janitors, food service workers, airport workers, and the like. And we know firsthand how climate change is impacting marginalized communities first and foremost. And so because that is our membership and where we live and our communities, this is something we take really seriously. Our national union has endorsed the Green New Deal, as has our local union, and so we are just very excited to be here.
Great. Can everybody in the back hear these folks? Okay, great. What we're going to do is we're going to start off a little personal, and then we'll go into the more knowledge-based content, and then we'll come back to the personal at the end. So the first thing that I'm hoping that you panelists could address is what events or experiences led you to your current career? Who wants to go first?
I can go first.
Go ahead.
All right. I prepared so I don't tell you my entire life story. My background's actually in the sciences. My father is an oceanographer. My mother is a science teacher. I have loved science and cared about the environment for as long as I can remember. And I can remember I was in college when the U.S. signed the Kyoto Protocol, and I was really excited. And I planned, for several years, I planned to go into environmental sciences. I wanted to do research to figure out how to not destroy our planet, advance that. And I was actually applying for EPA internships my senior year of college, or going into my senior year of college, and I had an environmental policy class at the Nicholas School of the Environment at Duke, and I had a professor who had been in the EPA for 20 plus years, and I went to him to get his aid, his advice, and I told him, I'm good at science, I love science, I want to go into the EPA, and he basically told me, Virginia, we don't need more research to save the environment. We already have all the research we need. What we don't have is the political will, because if the oil companies don't want it, it doesn't happen. And I didn't know what to do with that. So I went to grad school for theoretical evolutionary biology. So that's what brought me to Chicago, and I was in a graduate school, the Committee on Evolutionary Biology at the University of Chicago. And in my third year of graduate school, I was doing a lot of traveling. I went to a conference in Chile and then managed to travel for a while. I went to Panama for 2.5 months to work with collections at the Smithsonian. And I spoke, enough Spanish that I could make friends, travel around, talk to people. And the more I saw, the more I realized that the struggles most people have day to day, the things that are threatening their lives day to day, we don't need more research to solve. Scientists have already figured out a way how to produce enough food to feed everybody, how to clean drinking water, how to provide basic medical care, manage forests and fisheries sustainably, and so forth. And, science has solved these problems, yet as a society, we had not. And in fact, this was in 2004, and I was looking around, and hunger and other basic problems were growing in many parts of the world, and I decided that wasn't acceptable to me as a scientist. That to have the science be there and have it not be applied was not okay with me. So it wasn't acceptable to me as a scientist, it wasn't acceptable to me as a human being. So that's what set me on a path to figure out, what I could do to actually work to achieve the kind of sustainable development that science has made possible. And when I was looking for that, I took a leave of absence, and while I was looking, I started volunteering with Midwest Workers, and it made a lot of sense to me that, those who are struggling the most need to be a part of solving the problems. And that I saw that's what I could do day in, day out, going out door to door in the community, giving people, running survival benefit programs so that people who otherwise are totally consumed with survival can actually, be able to come together and actually fight for policies that worked in their interest. So I've been volunteering full time since 2005, and now it's come full circle for me because our members in 2015 endorsed the Agenda for Sustainable Development and are right now trying to mobilize a whole speaking campaign about the SDGs and the need to take urgent action on climate change because our people are hit by it first and hardest. So that's why I'm here.
Thank you.
Yeah.
So, not that my story's kind of flip-flop from what she said, but in some ways it is. Before I came to grad school, which I came here to get my Master in Public Health, I was living in Florida working with migrant farm workers. And I was working for a legal services agency representing farm workers, primarily with wage theft, but that also kind of led into some workers' comp cases. And when I was doing this work, I realized that their health is literally their income. Because if they weren't healthy, they couldn't work because they were paid by how much they picked, and they weren't salaried. So if they couldn't go to work, they weren't going to get paid. And so I went to Florida because I thought I wanted to be a lawyer, and then I realized that I didn't. And so then so that kind of transitioned me in thinking about the health of workers, which brought me to grad school. And while I was taking classes, I was also kind of reflecting on my experience in Guatemala. I was a Peace Corps volunteer in Guatemala, and a lot of times the ability to make the choice of what is sustainable or what is the environmentally correct choice was not the easy choice, or it wasn't even a choice, right? So they would wash their clothes in the river, which obviously is not healthy for the water, but they had no choice. They would throw garbage out of the bus, but they had no choice because they didn't have a trash collecting system. So after I graduated, in many ways I kind of fell into my work right now. I was working on more emergency preparedness oriented work in the public health field. But as I took on this role, I was realizing that part of this work has to be able to make available that the sustainable choice is the easy choice. And how climate change is affecting the health of everyone, but particularly those who are most at risk, is detrimental to their ability to provide for their families. And so now I'm here.
Thanks, Elena.
Let's see. So in college, I organized with a student group called United Students Against Sweatshops, and just very involved on like campus organizing. I think growing up as like a queer woman of color, like in a predominantly white space, very much like informed my politics and like pushed me to like always be fighting for justice and something. Right, exactly. Everything is always a fight, So anyways, I was organizing with USAS, and our food service workers at Ohio State were organizing. And so we were helping out as students to mobilize, and we were the clients of the university, and so we had a lot of power, or so we tried to think. And so anyways, I was also working full time, and when I graduated, SEIU, who the food service workers were organizing with, was like, "Oh, you want to organize full time?" And I was like, "That's a job?" Like, I was like, "You mean I can stop bartending?" Like, okay. So that's kind of why I'm here, and I've been organizing for the last 9 years, and it's been humbling and empowering, and I've just learned so much from every single person I've worked with, and just sitting in people's homes and hearing their stories and getting to know their families and the struggles that they are facing every day in and out of, living paycheck to paycheck, and then, even that not covering things. Those are the things that informs my work every day, and it was really clear, I think 10 years ago I didn't have the full understanding of what environmental racism is. I could see it, I lived it, I felt it, but I didn't have the words for it. And so in learning some of those things and piecing it together about how the workers were organizing, their children have high rates of asthma and other sorts of health issues, and they're worried about the lead in their water, and all of these things kind of like came together over the last few years. And so as an organization, we started really taking it seriously of how do we address this issue in a meaningful way, and how do we think intersectionally about what does justice look like? Yes, we fight for economic justice and worker justice all the time, but can we really win that if we also don't win environmental justice and immigrant justice and racial justice? Because you really cannot pull any of these issues out from the other. And so that's why I'm here today.
Thank you.
Yeah.
Thanks to all three of you. Now let's move into a little bit of some knowledge content with this first question of what you feel is the greatest threat to workers' health. Elena?
In reference to climate change, right? Is that
Yes, sorry. Climate change
Okay,
effects.
just wanted
Sorry, climate change,
Sure.
current climate change effects to workers. What part of it is the biggest threat, do you think?
I think that when we think of particularly low-income workers, in many ways it's the threat to their jobs. because when you think of outside workers, when you and extreme weather events, there's a good possibility that climate change will change how we work. And so what does that look like for the workforce, particularly in industries that rely on outside environments? Inside environments are definitely inside workers are definitely affected, but you think of service jobs and you think of agriculture and construction, landscape, all of these jobs rely on stable environments. And so when you throw in instability, then it can completely turn the work upside down and pose a threat to the whole system of what they're doing, which can obviously be really detrimental to their livelihood and supporting their family. And we all know the connections between income and health. And so I think simply how it could threaten how they are working, like what the jobs are actually doing, I think is a really big threat.
Theresa?
Yeah, I think echo a lot of what you said. I think there are several ways in which the workers we organize are impacted by climate change and their health. I mean, the first thing that comes to mind is just like extreme weather events and how that impacts livelihoods. And you know, we organize the airport workers at O'Hare and Midway, and so this is like just a very local example. During the polar vortexes, you know, a lot of people couldn't get to work, but they were still expected to show up at the airport, even though it was -50 out. And, you know, so people had to make choices of what do we do about childcare? What do we do about trying to get to work and not lose our jobs and lose wages? And it's that lack of access to adequate health care in these low-wage workers that means that you can't properly address your kid's asthma, or you know, maybe you can't afford to go get your kid's blood tested for lead levels and things like that. I think it's just these cumulative effects of economic insecurity that just really make resilience to climate change, whether it's an extreme weather event or it's more of like an environmental racism, like toxic pollution of situation. Like, you just can't be as resilient and bounce back to those things without adequate wages and a secure job and health insurance and access to care.
Yeah, absolutely. I mean, in terms of tacking on to what both of y'all said, I mean, in terms of what Elena said, in terms of changing jobs, you know, we have a lot of members who do landscaping work, which is, you know, often either independent contract or through a company, but landscaping work, you know, obviously the increased heat in the summer, as well as the poor air quality, right? You know, Chicago or the Cook County, whatever, has like an F from the American Lung Association, largely because of smog. Like, and the high ozone days have doubled in the last 4 years or something. And, you know, right, outdoor workers, who's out there, whether you're an outdoor worker or you're just, as Theresa was saying, a low-income worker who, how do you cross from one side of the city to another? You know, how do you cross from your home on the south side to your job in the more job-dense north side, or out in the suburbs? Is this probably public transportation, which means you're outside waiting for a bus, you're outside, right, you know, walking, etc. So things like the higher rates of smog, the high ozone days, where, yeah, any of our people being out in the weather, and then like I said, landscaping workers on the one hand, more difficult conditions in the summer, but also I've seen, even in just the 14 years I've been organizing, our members who do landscaping in the summer usually do snow removal in the winter. So whether you get a big snow blast, like a polar vortex with snow and then freezing cold, and you're trying to actually be out there removing the snow in really brutal conditions. You know, I've talked to members who've done snow removal for 2.5 days straight, you know, because that's how they were going to make money for the winter. But then more recently, it's also been long stretches with no snow, right? So because we have our weather is getting so variable and knocked out of whack that So then if you're a landscaping worker, you're not working all winter long, more or less. So, and then you combine that with when the weather's, homes in poor and minority communities are on average 22 degrees hotter in the summer than homes in wealthier communities, just whether it's because how they're built, they're not weatherized, people can't afford that. And then, as People's Gas and ComEd have continued to jack up their rates and with state approval, making record profits, then people simply can't afford those bills because wages aren't going up that way. So it's across the board. Yeah, once you go, when you're at work, it's harder conditions. You're waiting for the bus, it's harder conditions. You get home, you can't afford to do climate control in your home. And, there was something like 86,000 families in Illinois that went without heat in the winter last year. So and that was including through the polar vortex. So, yeah, I'd say, ultimately, what's the number one threat to workers and communities' health? It's poverty, because you can't deal with any of the ramifications if you don't have the resources to.
I want to share a story of one of our members. His name is Noel, and he's spoken a lot about this issue. He's an immigrant not an immigrant really, but his family is in Puerto Rico, and their home was destroyed from Hurricane Maria. And he just shares this story of this is why he is involved in the fight against climate change. After Hurricane Maria, let's talk about an impact to jobs. There were no jobs, right? Everything was ground to a halt. And his father is a diabetic and couldn't get to the pharmacy for weeks and ran out of medicine because the roads were impassable. And it's these sorts of events are just growing increasingly common, and if you just can't access healthcare and things like that, and you don't have money to evacuate, this is how climate change is impacting workers and folks on the margins.
Thanks.
Yeah.
I'm sitting down here so I can sit in a chair, but I'll join the panel for a minute and just say that, for this question in particular, as a physician, I am really worried about heat effects or the heat effects on health of these extreme heat events. So I am just extremely worried about people who have to work outside that you mentioned. So we've got people who their jobs require them to be outside in the summertime, often in full gear. So you're talking firefighters, public safety officers that have to wear these bulletproof vests. People are directing traffic. You got accidents, traffic accidents that need to be cleaned up. So any type of emergency personnel, it doesn't matter how hot it is, they have to be out in it. And we are not acclimatized to these hot, these hot spikes, and that's why there are more deaths up here, up north, than there are down south, where it's in 90s and humid by May or April or May, and so they do get acclimatized, and we kind of bounce along with our beautiful 85-degree weather, and then boom, you get 97 and humid, and our bodies can't handle it. So I just had to throw that one in there. So let's talk about how the impact of climate change on low-income workers versus the high-income workers, and what differences you see in how climate change might affect those two different classes of workers. Theresa, do you want to go first?
Sure. I think along with everything else, I feel like I'm kind of repeating myself, but when you are a low-income person, you are just making choices every day between necessities, and the concept of having, any amount of savings to fall on when you're in a crisis is, it's not there. And so whether it's some extreme weather event or a hurricane, or, you find out that your soil is polluted with manganese, you can't move. How are you supposed to afford to move and to get out of that? Or, your family's home, the school is, there's diesel trucks. They just built a new warehouse. I wish Olga was here. I think she could really speak well to that. Yeah. But, I've learned a lot from her on these issues. And so it's just about having a cushion. And when you're a low-income person, you don't have a cushion to deal with any of those things. You probably don't have health care, or if you do have health care, it's so terrible. You have a $5,000 deductible and you can't afford to go to the doctor when there's a problem. And, I think sort of broadly, this is just, we're in a dual crisis of extreme income inequality and like a climate crisis. And you really cannot decouple these things. It is capitalism that is driving the climate crisis, and necessarily it's an extractive economy. And, I just don't think we can, we just can't, it's no accident that wealth inequality is at an all-time high, as is, our climate crisis and the way that things are going. And it's very much in the interest of the 1% to keep extracting as much wealth, and that means both from the earth but also from human capital, right? It's the race to the bottom in terms of wages and benefits. And I just think it's all very connected.
Mm-hmm. Yeah, I would echo that. I mean, generally speaking, we are all at a higher risk for all of these health effects, but there are certain populations that are at an even higher risk. And so it's the low-income communities that are at the highest risk, whether it's where they work, how they get to work, where they live, and the ability to protect yourself. So if you might have air conditioning, but you can't afford to pay it or turn it on, you might not have access to air conditioning. You might have really great flood insurance, private flood insurance, or you may not. Or where you live, because of where it is, like maybe closer or in a floodplain, you might not be eligible for flood insurance. And all of that is related to how you're able to protect yourself, right? We're not even talking about slowing down climate change, but simply adapting to it. And the ability to adapt to it really does rely on how much you make, and because how much you make also determines where you live. And you can look at the city of Chicago, and you have different neighborhoods where one has lots of green space and tree canopies, which provide shade as well as flood mitigation, and another community does not and has asphalt, which does not allow, it heats it up, but then it also does not allow water to seep into the ground. So generally speaking, low-income communities are at a much higher risk for all of the effects of climate change.
Absolutely. And just to pick up on what both of y'all said, I mean, right, whether it's paying for, a higher utility bill for heating gas, a higher utility bill for electricity. Yeah, a lot of our people, like Theresa was saying, people are doing, it's like bill juggling, right? You have to rob Peter to pay Paul all the time. So the notion of, well, I'll just turn up the heat a little more, right? Even if you have it, or, turn up the AC a little bit. Oftentimes not an option. I mean, people will choose to not do that. So our people, are hit the hardest. And then, low-income workers also, a lot of times, there's ultimately no protection in the state from getting shut off from electricity and living through the summer without electricity, or living through the winter without heating gas. I mean, we've fought cases. We met somebody on a door-to-door membership canvass on the south side in Inglewood this past winter in January, about a week before the last polar vortex. And this family had no heat in the home. And it turns out, the landlord had actually called into People's Gas and said, oh, there's no one living here, turn off the heat, right? Because he was trying to get the tenants out to flip the building because there's more development around there, because Whole Foods has come in and blah, blah, blah. So people are looking to flip the building. And why he was doing it in January is beyond me. But anyway, so they didn't have gas, and we called People's Gas and said, listen, there's a family with children, including an infant, living in this home with no heat. And they said, oh, well, the landlord said to turn it off. And they said no one was living there. I said, well, there is, so turn it back on. And we actually had to have a team of advocates work on it, including a UIC student who could come in, between classes and stuff. And when we first called the Illinois Commerce Commission, which is a state regulatory agency, to report this and say, listen, there's a family living without heat, the role of the state is to ensure utility service is affordable and available to all. The ICC representative said, well, that sounds like a landlord-tenant issue. You should get an attorney. And we were like, excuse me. I mean, it took us literally a week of advocacy on the phone to get people's gas to go out there and turn them on. So when you see, there's that, and then and then people are using space heaters. This family, and I kid you not, 4 kids under the age of 15, including a severe asthmatic, including an infant, like a 3-month-old, they were heating the house with a propane heater. And they're not stupid, and they don't hate their children, right? This was the way they were staying warm. And the mom, when we did advocacy for her, was she was a wreck. She just said she doesn't sleep at night because she was going around through the night. She'd go around just checking to make sure her family was still alive and still breathing, but our people have to use propane heaters, electric space heaters. So when you get a statistic, I was dealing with this recently, the Cook County Medical Examiner said there were 59 cold-related deaths this past winter. 59 in Cook County. And that was a 25% increase over the prior winter. And I guarantee you, if you look, where are those deaths? You can look at their map, and it's mostly, it's South Side, it's West Side, it's poor communities, it's people of color, it's those, as we're talking about, it's all those different, disadvantages every day, but it's really, the poverty and inequality. So it's not the same. And I echo absolutely, the neighborhoods are different. And then also the health in terms of what I was talking about, the air quality and the increased high ozone days. We've got 65,000 children and over 1/3 adults with asthma in the state or in our county. And there's about 1 in 5 have some kind of cost barrier to care. So don't have their asthma under control. I think the Illinois Department of Public Health says about half don't have their asthma under control, right? And a lot of it's because of cost, whether it's access to a doctor. So when we talk about, the effects of climate change, it's right, those who are medically most vulnerable already don't have nutritious foods, so your immune system's not as good, all of that compounds. So when they say 59 cold-related deaths, that's, I'm sure, an underestimate.
There's one thing really quickly. So San Francisco Department of Public Health, they did a whole vulnerability assessment of their city. And they went down to the census tract level. And one of the maps that they had was looking at a snapshot one day of what was the temperature, a high heat day, and compared it to income. And not terribly surprising, but the highest, the census tracts with the highest heat were also the poorest census tracts. And there was one where there was this one big census tract, right? And then surrounded by it, so it was a low income, and surrounded by it was all high income. And you look at the temperature map, and it reflected the same thing. That one census tract was among the highest temperatures, and all the census tracts around it were not. So it was red and blue and green.
Because of tree canopy?
I'm assuming. I don't even know what the census tracts look like, but I would imagine it's tree canopy. It's
greenery in general.
Yeah. Less asphalt.
So I'm wondering if is this Olga? Oh, great. Hi, Olga. We're glad you made it. I'll let you catch your breath. Let's talk about what your organizations are doing to help workers deal with these health threats from climate change. Or if your organization is directly trying to help mitigate climate change. Can you tell us a little bit about that?
Sure, I can start. Yeah. As I said, in terms of the big picture, we have our members, Midwest Workers Association members, endorsed the Sustainable Development Goals back in 2015, and we've been promoting them in our newspaper. Now we're running a whole speaking campaign, in terms of getting actively involved in that fight, because we see ultimately I think Elena was saying, we need to have a situation where the sustainable choice is the easy choice, or it's at least a viable choice, and it's the one that's available to all of us as individuals. But more importantly, that's got to come from a policy level. That's government decisions. So, our members are organizing for the long term to be able to have that kind of power and accord with our numbers to set those policies, because poor people need it. We're the majority and we need it. But in the immediate, a big part of it is for us, if folks have read, Eric Kleinenberg's book of Heat Wave, about the 1995 heat wave, he said on the one hand, you look at income, you look at race, but also you look at community connectedness, and that people who are the most isolated were the most at risk when you combine it with those other factors. So while we're organizing for the long term, one of the biggest benefits we see day in, day out is that we are organizing 7 days a week, 365 days in the community. Our office is open 7 days a week, 9 to 9. We have it available as a cooling center in the summer, a warming center in the winter, and where people can come and instead of just, sit and watching the clock for the 12 hours, can have actual productive work to do. And then we, members will call other members to be able to offer the office as a cooling center or warming center, check in on them. How are they doing with food? We actually can organize transportation for members to come to the warming center or cooling center, because that's another problem too, right? The city may have them there and it's open from 9 to 6 or whatever, or 9 to 8. And then it's like, okay, but then when it's 8 o'clock and it's 10 degrees out, I'm supposed to wait for a bus to get home, So one is, we make that available, and then we actually, every week we're out canvassing door to door to reach families who may already have their electricity shut off or be facing a shut off. Electricity, gas, water, we'll do the advocacy to stop the shut off, get the service turned back on. We've actually our members have taken on multiple times fighting rate increases for People's Gas and ComEd, and blocked about $1.5 billion in rate increases, which at least have made it less unaffordable. And then also dealing with, we have an emergency food benefit, then we can get food to members 7 days a week, supplemental food benefits with fresh fruits and vegetables run by volunteers and members, and also general medical sessions where we can, where I can guarantee you, we have a physician who volunteers with us out in the suburbs, for example, out in Clarendon Hills, who normally he's seeing people with, with money, with resources. But he volunteers with us because he sees, these are the people who need the care the most. And we've found people with totally undiagnosed, untreated asthma, heart disease, diabetes, high blood pressure, the kinds of things that if you don't treat it, it will kill you. And, I've been able to actually deal and get people's medical conditions under control, where with these heat waves and polar vortexes, that would be the end of it, especially, with the extreme weather. But so we see, organization itself is part of what helps people to, being in a community is part of what helps people to be able to deal with the impacts of climate change, with, of course, the long-term goal being to stop it and reverse it. It's adaptation for the immediate while we fight for the long term, and organization is needed for both.
So we don't work directly with workers, but because we're a state level program, and I think a lot of the work that's involved in helping to prepare workers is at the community level. But so some of the community level work that we are doing is working with local health departments and trying to build their capacity and their ability to be better prepared for the health effects from climate change. We've created a heat toolkit that's supposed to be like a plug and play for local health departments, and in that we've advised them to develop an outreach plan, particularly to at-risk populations. The concept of calling your neighbor when it's hot or when it's cold, like that actually comes from the 95 Chicago heat wave, because there were so many individuals that were alone and nobody checked in on them. So whenever you hear that check in on your neighbor, it comes from the 95 Chicago heat wave. And so we're trying to encourage local health departments, maybe they work with community-based organizations in their community to create some type of outreach plan so that they reach at-risk populations. Also with that toolkit, a research project that we did was look at heat hospitalization risk for the state of Illinois at the county level. We actually found that rural counties had a higher heat hospitalization risk than urban counties. And, heat is often thought of as an urban problem. So this has actually been really useful in talking to local health departments outside of the Chicagoland area, because it's not often, floods are very present and on the landscape of anybody really in Illinois, but heat isn't. And, we haven't done any research as to why, but some hypotheses are that there are more people that work outside in rural communities. So those are kind of some of the projects that we've done. We've also created a flood preparedness map, so looking at, and you can zoom into the county level. So it's looking at how healthcare facilities, and we broadly define healthcare facilities, where they are located in relation to floodplains. Now, the challenge to the map is that it's 1996 floodplain data, and floodplains have changed, but that is the most comprehensive data set that we have available to us. So we don't directly work with workers, but we're trying to work in at the local level, provide guidance to local communities who can then better protect all of their community members.
Thanks. Theresa?
Yeah, in terms of both like adaptation and mitigation, I mean, nationally we have pulled together a lot of rapid response actions after a hurricane or a big flood or the wildfires, and just in terms of like getting supplies out to members that need them. But more locally, I think this is something we're still contemplating of, like, how do we use our collective bargaining power and process to address climate justice concerns. And I will share one example that I'm really proud of. Is just recently we were bargaining a contract with the maintenance and facility workers at Joliet Junior College, and they came to us and said, yes, we're concerned about wages and all this stuff, but also we're really concerned about using Roundup on our campus, and we're really concerned about all this asbestos that we're asked to remove. And so we were like, all right, yeah, that's pretty messed up. Like, let's do something about that. And through bargaining, we were able to eliminate the use of Roundup on the campus, which helps both the workers who are applying it and also all the students. I mean, they had one worker applying Roundup for the last 10 years, and I'm very concerned about his health. And we were able to win not only, well, at first, let me just say, like, the college was like, well, we'll, sure, we'll get rid of Roundup, but after we use up what we have, and we were like, no, like, you have to stop right now.
Yeah.
And we were able to also win, like, some forward-going, like, health protections for these workers, like the ability to go to the school health centers and things like that to monitor their health. So, I want to keep thinking of, like, how do we, some people refer to it as, like, bargaining for the common good. And locally, this is something we're really contemplating of, how do we address climate change within our worker power, not just within, like, our political power, which is also something we're working on. So, yeah, I think that's all I have to say.
Okay, Olga. Olga Bautista, what I'd like you to do is you get your choice of which questions to address that we've done so far. So I'd like you to introduce yourself and the organization, a couple sentences about the organization that you're representing today, and then if you could either address what events or experiences led you to your current career, what do you feel is the greatest threat to workers' health in terms of climate change, and what can we do, what were we talking about? Oh, mitigation, what we can do to, what's your organization doing to either mitigate climate change, or you heard me ask that question when you walked in, are you doing things for workers?
Yeah, thank you first of all for having me. I apologize for being late. I'm from the southeast side of Chicago. About 6 years ago, we were battled with the notorious Koch brothers. They were storing some toxic material along the banks of the Calumet River. So the Lake Michigan's like this, right? And we're kind of down here, right by Indiana. And on the Indiana side, there's the biggest oil refinery in the Western Hemisphere, BP. And they have been bringing tar sands through a pipeline that goes really close to Lake Michigan, all the way to the BP refinery. And then when they refine this material, there is a lot more waste product, and this is the petroleum coke. So because there's a river, so this is the Lake Michigan, and then there's a river that cuts through, and it goes all the way to the Mississippi River and then down to the Gulf. So that Calumet River connects it to, I think, the Des Plaines River, and then to the Mississippi River. And so it's like an industrial corridor for the city of Chicago, for Illinois, and a lot of material is stored along those riverbanks because there's a lot of industry there, because it's just logistically ideal, right? So BP would refine this tar sands. They would have this waste. They would store it on the banks of the Calumet River because it's used as an industrial fuel. So like to make cement and other things, it would be sent out to other places. So we were always accustomed our whole lives, the people who live in the southeast side, just seeing these big giant black piles of stuff. But back then it was coal. It was actually coal that was used at the coal fire plants here in Pilsen and Little Village. When those closed, they started to store petroleum coke at the site. So it was just like perfect timing for these bulk storage, facilities, because the coal was gone. But then BP just did a $4 billion upgrade to their operation so they could process this stuff. So then they just started storing the pet coke. The piles. There was no regulations in the city of Chicago. So what happened, the events that led us to get to where we are now, were one, that there was no regulations for bulk storage of petroleum coke in the city of Chicago. So they actually were breaking the law. So 70-foot piles of petroleum coke were perfectly fine, right? Also, in the 80s, when industry, manufacturing, everything was going overseas, steel production and all the rest of it, the city created these planned manufacturing districts. So basically they were trying to hold on to the opportunities to be able to have jobs for folks, to have this tax revenue and all the rest of it. So they created these PMDs where basically it was kind of like, that's, it's zoned for whatever the F you want to do. And just, they actually had a concierge at the city who would help the developers and folks do the permits and all the rest of it. And the unintended consequence was that it created a lot of harm to the residents who were living adjacent to these PMDs. So what we found out was that it was the Koch brothers. And we started, Facebook was actually super useful. We had over 11,000, at that time it was 11,000 neighborhood folks who were on the east side. I don't know why I was doing quotes. It's not a fake group, it's a real group. The east side page. My daughter always gets at me for using it wrong. But so there's this page where folks are to find out who the Koch brothers were, these bad guys. Oh, now there's only one. So, but but not only were they were actually funding scientists to come up with data that showed that climate change wasn't real. They were also really against labor, and organized labor. So then we didn't want the Koch brothers or their pet coke in the neighborhood, and that's what it was. Just like the perfect storm, and people were able to organize. Long story short, since then, the city of Chicago now has regulations for bulk storage. We have found out other toxic material that's being held there. And where the climate change comes into the picture is that there's a lot of polluted land, a lot of brownfields and Superfund sites across the whole 10th Ward that concerns us because of the sewer system that we have in our city, that if there's flooding or flash floods that overwhelm the system, the water that's draining in can potentially be also having toxic material in it. And I'm not talking about like serious, like the stuff that Aaron Brockovich was finding, right? Like chromium, and right now I'm a little frazzled, so I don't have all the names of the manganese, just really, really bad things. So where we are now is that we are working, we fought for a seat at the table. You know, we worked with the city of Chicago. We're meeting with the Department of Public Health. What we discovered is that when a permit comes into the city, it gets permitted through the Department of Planning and Development and like buildings and sewer and all these CDOT and all these things. But the Department of Public Health regulates them, but they don't get to know what's coming through, you know, until it's already all been approved. So we've been working with the city to, especially now that we have a new mayor, we have a new Department of Planning and Development, to try to like, you know, work around these issues so that we have the people who are going to be regulating, the inspectors, to be aware of the situations on the front end, since they're the ones who are going to have to go out and ticket them and cite them and see how they're working.
Great, thanks a lot. We are going to open it up for questions, but I'd like to ask you all one more question before we open it up, and that is, let's talk about this transitioning of workers into the green economy. So can you weigh in on what we can do to safely transition workers away from fossil fuels to low carbon industries? Virginia?
Sure. Yeah, obviously our members have thought about this a lot here, and we're part of a nationwide effort across the country, so we do have people who work in various kinds of, industries affected by, who would be affected by changing the energy industry. And I'm personally from Louisiana, so my state needs it bad, but needs the jobs bad, but needs them to not be petroleum jobs. But yeah, we see there's, incredible potential for new job growth through green strategies, and that the government absolutely has the ability to do this, at every level. The resources, the technology, and also their commitment to the 2030 Agenda for Sustainable Development, which talks about that, because our government, the federal government, actually signed on to it in 2015. They said they would do this, that they would work tirelessly toward that. But there's something like already 260,000 people in the U.S. employed in the solar industry, and that's even with entities like the Koch brothers fighting the expansion of solar all across the country. So if you release that economic potential, like it was $154 billion in economic input and hundreds of thousands of jobs even just a few years ago. So, if we could expand solar, the U.S. Department of Energy says that the U.S., to meet their pledge to make 20% of energy in the U.S. wind power by 2030, they would need 100,000 new wind turbines, which would create 500,000 jobs. But at this point, that's like all talk, not action. And then you think of also with the kinds of things Elena was talking about in terms of how poor communities, those most vulnerable to climate change, are already the hottest, the most asphalt, least trees. How many people could we put to work doing things like reforesting, not just in rural areas, but in urban areas, like make our cities more livable on every level, not to mention, soak up the water, instead of having flooding, we have water like trapped, having, leaf coverage, et cetera, canopy cover, that was what I was looking for. But all of that would take having, government policies prioritizing those things, So we definitely see an incredible amount of potential, but it would take the government prioritizing that and actually making good on their promise. So like our members right now are really, part of our speaking campaign and what we're trying to push, in addition to getting the city to replace all the lead service lines in the city for water, which is a different issue, we can talk more about. That's not climate change, but it's also killing all of us. So especially, and damaging infants and children, but we can talk about that. But in terms of the Sustainable Development Goals, we're saying, okay, it's not the city of Chicago that signed on to them, but the city of Chicago should endorse them. The city of Chicago should start making sure all of their policies are consistent with accomplishing the Sustainable Development Goals. And then the city of Chicago, which is one of the biggest cities in the country, right? Like it's not a lot of mayors who get elected and they go to the White House, they go make their rounds in Washington. Our city has a lot of clout. Our city should be pushing for the federal government to actually, develop an action plan for full implementation, which if you really look at the Sustainable Development Goals, it's talking about, like we've been saying, all these things are all tied together, right? You got to deal with, yes, stopping fossil fuel use, but, that means we need replacement technologies, green technologies. So there really is a way to, it's not a matter of throwing people out of the coal industry. There's only tens of thousands in the coal industry, and there's already hundreds of thousands in solar power, but it's going to take us, the people, organizing and demanding our government do that.
Right. Olga, do you want to?
Sure. So I was actually invited by Caitlin and Marsha to a really interesting conference. So if you guys go to conferences, you know that sometimes you go to a conference and everybody's kind of like preaching to the choir, like you're all agree on stuff. This conference was not like that. You were out of that. You were so this is the Labor Network for Sustainability conference, and I really really important things happened at this conference. One, the panels were a mixture of folks who are already impacted, right? Because the just transition was needed a long time ago. There's already people who are working in coal all across the state of Illinois, all across the South, that have lost their jobs, lost their homes, complete an utter devastation to rural communities everywhere. And so some of those folks were on the panel, and then also folks who are environmentalists, and it was also very diplomatic. Like people were, but we were talking about these things, and I think that we don't have like the answer. I think like radical change has to happen in order for us to be able to really meet the needs of workers in the face of climate change and the serious need for sustainable energy and renewable energies. The other thing that I think, also what happened in this conference that I found out later was that there needed to be like a caucus of like a lot of the folks who were organizing this conference were predominantly male, predominantly white, and out of this, like the people who were attending were like, we don't feel represented, we don't feel heard, we want to be part of the planning, like this is a serious issue, we're being impacted now. And the organizers, I think the right thing to say we need to assess the situation. We really they were supportive of this. The second thing I think that is already happening is that, holy cow, the youth, like they are like growing up and becoming adults in an age where they are making some like becoming aware of the gravity of the situation, and they are actually inspiring a lot of folks to not just be talking about it, but to actually be doing it. Like, what is the policy? Let us write it down right now. Let us, folks like AOC and other folks who are pushing like the Green New Deal, it's a new generation. It's young people, and we need to be able to make the space and get the hell out of the way, because we had our chance, and learn, and that we have to listen and do what they say. That this is. I mean, there's people who are making decisions about their family, like if they're going to have families or not, because how terrible, climate change is already affecting. When we have, we had Katrina, we had Hurricane Sandy, we had, ginormous, tsunamis who took out, just entire towns. And so yeah, like, it is, it's a little too late. It's like people have already been harmed. And I think that we do have to get out of our comfort zone. And like this conference that happened, we need a lot more of that. We need an investment in learning and figuring out and hashing out these issues, and being honest and saying we don't know what the answer is, but we know what we have right now is definitely not freaking working.
Theresa?
Yeah, thanks, Olga. Okay, so, I mean, a transition is inevitable, both because we need it and because coal plants and other fossil fuels are not financially, economically profitable in the same way compared to renewable energy sources. So, in my mind, why aren't we a part of that solution, right? If it's going to happen, I want to have a say in how that's going to happen. I don't want it to happen to me as a worker. So, I think there are a lot of, I think that shift, that thinking is shifting a little bit, which is encouraging, that people are starting to realize like this is kind of inevitability, and like, they are still digging their heels in and still wanting lots of subsidies, but the only reason coal is still around is because of government subsidies, right? And so, really locally, SEIU was, organizing in favor of the closure of the coal plants in Pilsen and Little Village as well, even though we did have workers there, we had members there, but we wanted to make sure that their health was fine, and that their families and the communities were, that these needed to shut down, and we were able to find them other jobs elsewhere. When we think more like broadly about what is a just transition for a whole industry, for like 1 million workers or something in this country, I think there are a lot of things to consider, both in terms of the immediate needs of the workers and the communities that they live in, but also more broadly speaking, just generally about the economy and the industries that are providing lots of jobs. When we saw deindustrialization, it's not that, with the growth of service sector work in this country, like we need to think really a lot more radically about what does it look like to have unions for all, right? Not every person that's working in a coal plant is going to go get a job as a solar panel installer. They might go be a home healthcare worker. And right now, those jobs really aren't paid well at all. And so, like, how do we think more aggressively and radically about changing our entire economy so that all people have access to a job that supports a family? So that's like one thing to just sort of that grounds my thinking. And I think that's what's really exciting about the Green New Deal is it does try to address those things. It talks about Medicare for all and childcare for all, and that childcare and education and these things are low carbon work, and needed to create a livable economy for everybody, including those who are impacted by the displacement of fossil fuels. I think more specifically on the issue of like, I'm a coal plant worker, what happens to me? I think there are lots of things we can think about, including advance notice of any plant closures, several years if possible. And there are all sorts of things and programs we could put in place, like at the state level, which we're contemplating doing with the Clean Energy Jobs Act, which we're trying to pass in Illinois right now, like, prioritization for employment for state jobs, full tuition assistance if you want to go back to school, other sorts of like wraparound services, like financial planning services for the families and the workers that were displaced, or relocation funding, because you know sometimes these plants are in communities that are very rural and there aren't a lot of other jobs, and you know, can we help pay for them to move to Chicago where there are more jobs? Let's see, what other thing? Extended health insurance, you know, like Cobra is like crap.
Yeah.
You can't
Yeah.
afford it, right? And and so like extended health insurance, or if you want to talk more broadly, like what does Medicare for all look like? And then like responsible pension protection for workers that is not dependent on the financial solvency of their company. Those are some really concrete things that are needed in a just transition. And there was one other thing I wanted to say. I'm sorry. Oh, the polluters should pay, right? They should pay for all of these. They have made billions of dollars in profits, and they should be the ones to make sure that workers are not left high and dry when they shut down. And these, like I said, these things are already shutting down. In Illinois, too, it was just announced that 2 more plants are closing because it's just not economic. It's not profitable. And so, you know, are they thinking about all of these things for the workers? Not really. Not unless we force them to. So.
I know, Elena, I haven't given you a chance yet, but I would like to have some time to open it up for questions. So if you could incorporate your answer into one of these, if someone has a question. So let's take a few minutes to answer any questions that you might have. Yes.
I was wondering, do those windmills utilize those special metals, earth metals? Does anybody know, or perhaps the windmills utilize the kind of alternator that you find in a car with an electromagnet? I was wondering which kind of method did they use.
Does anybody know
No idea. I don't know.
what wind turbines are made of? I'm sorry.
I'm
We're
told
health. We
that-
can tell you the health effects.
There's a shortage of rare earth metals, and so if they're made with those, that could affect spreading the windmills all over the country.
Yeah. No, there are going
So
to be.
I tinker in this stuff, so I was wondering.
Okay. Yeah. Yes.
You spoke earlier of
Oh, yeah. Yes.
is that like open source?
Yeah.
A what?
I wish I knew the link, but it's like, you know how ArcGIS has an open access?
Yeah.
If you Google Illinois Flood Preparedness Map, ArcGIS, it might come up because it's a specific link.
Is it a state of Illinois?
No, it's just
isn't it
ArcGIS.
FEMA? Isn't it FEMA?
No, it's one that we created.
Oh, sorry.
Yeah.
Oh,
no,
you
so
guys
it's,
created it.
Yeah, so it's on our, it's the public path of ArcGIS, so anybody can access it.
Oh, cool.
Yeah.
Yes.
Well, I was thinking about in terms of workers who are affected by climate change. One of the things that occurs to me is that people responding to climate events, for example, cleaning up after floods, fighting fires, cleaning up after storms and things like that, those people are often going to be placed in great risk. For example, with the floods, like you were mentioning and like you mentioned, they're bringing up all these toxic materials, and then people are going to be exposed to that. You know, we, in some of the classes in SPH, we talk about the Deepwater Horizon. There's a case study, which is, of course, is not necessarily climate change, but it is related because it's oil.
Yes.
So I take it back, it is. And all the exposure to the chemicals. So anyway, I just thought that was another area where climate change directly affects some workers in different ways than others.
Yeah.
And it's not just the exposure to chemicals, but mental health and like the traumatic experience and events that happens in being a response worker.
It's also, those are also often high heat exposure jobs, right? So to protect against chemical exposures or air pollution, say for fighting fires, we put them in a lot of protective clothing, which then puts them at even greater risk of heat exposures or heat stress.
Yeah. Any questions? You guys can fight over this. Yeah.
So in talking about like extreme weather events, do you guys know of anything employers are doing to help protect workers? So whether it's scheduling differently so they're not outside as much, or different like transportation options to and from work?
I don't know. Oh,
No, go ahead.
I'm not sure about here, but I did read like in India, like this summer they had like a crazy heat wave, and I know that they changed the work hours so that people were and like all like the social service offices and everything were actually open at night instead of during the day, so that people can go and get like whatever, just changing the time of day when people would be out getting services, social services and stuff like that.
So I'll incorporate my answer to the last question to this question. So Washington, OSHA in Washington, in the state of Washington, and OSHA in California have much more strict regulations than federal OSHA, particularly around heat. So, this isn't to say that, I'm not saying that like employers are actively doing this, they're actually required to do it. So this is what I was gonna respond to in terms of how to ensure a safe transition, because even if you're installing solar or windmills, you're outside, right? Or replanting, you're outside. So their regulations are much more strict. They require that employers train their employees on heat and what you can do about it. So the two states are slightly different, and I don't remember exactly what the differences are, but they're generally the same, more or less. They also require them to have some type of shade structure that's available for them. They are also required, and I know that one of the problems in California was that they didn't have enough people to actually regulate this, or enforce it. But they're also required that if it exceeds a certain temperature, they are to tell their workers to stop working, and or to have them stop every so often and sit in the shade and drink water. So it's not necessarily, I would probably argue that it's more important to have a regulation because most employers are probably not going to choose to do it. Maybe there are some really great employers, but that's kind of a best practice or better practice.
Yeah, great. All right, so let's go back to the personal to close. And if you could tell us what keeps you inspired in the midst of all the bad news surrounding climate change. Let's leave on a positive note.
Good.
Well,
There.
when thinking about this, I took one line from a great documentary, if anybody's seen it, it's called Home, Earth from Above, and it deals with that. But they talk about, it's too late to be a pessimist. It's too late. Like we have to do this, and
Right.
yeah. So I stole the line. I thought I'd attribute it. But there are solutions. What gives me hope, what gives me excitement is, one, I know there are solutions to these problems, right? Scientists have figured it out. The majority of people want it. As Olga was already mentioning, right? The youth are like in the streets saying, wake up, everybody. Whatever you've been doing, even those of you who are trying to be responsible toward the environment, it's not enough. Like, we need action now. And the fact that the Sustainable Development Goals, all 193 nations at the United Nations did agree to them, and some countries are moving on them. Like, this is a time of tremendous potential. And then, for myself, I see, every day I see people from all walks of life, in this country that's like so, constantly promoting divisiveness, and everybody being concerned about their issue and fighting each other. And we have people from all walks of life who say, yes, we need to have common solutions to our common problems and are working together to fight to make it happen. It's like, we can solve these problems, we just need the organization to be able to demand it and command it. So every day I see people coming together to build that. So that's what gives me hope for the future, absolutely.
There's a political cartoon of, it's some type of convention and somebody stands up and it's like, what if we did all of these things? We made the world a better place. Because the reality is when you think of all these different strategies, it addresses so many issues, right? And so it's like, it's such a bang for your buck. So I try to keep that political cartoon in the back of my head. And on a personal note, we just had a baby, and I like to think of him as like my little mini Green Corps. And we talk about it every day.
Great.
You're never too small to make a change.
That's right.
What gives me hope? Yeah, it's hard sometimes, right? To be quite honest, it's really exhausting, especially when there is so little political will, or when there are people in power who say all the right things and then refuse to do anything. It's really frustrating, but yeah, the youth, like Olga invoked earlier, the climate strike on Friday was really great, really inspiring, that teenagers were just out there pulling out thousands of people. I called the main organizer. I was like, hey, we want to help out. And she was like, great, we have it all under control. And I was like,
All right.
awesome, we'll show up, and that never happens. I love it.
To show up to something you didn't
To
plan.
show up. And I have 2 small children, and so if we don't fight this, what is their world going forward? So.
So, I mean, ultimately, I'm a revolutionary. I don't believe that capitalism is ever going to work. Poverty, capitalism can't work without poverty. And that's not right. And I believe that, there's so many people who are starting to realize that, we have a city council with open democratic socialists, I think 9 or something
like that, yeah.
I don't know.
A lot.
Almost, a fifth of the city council. And all of those little wins, I feel like, Bernie Sanders is really good. He's able to really, talk about how we need Medicare for all and all these things. And that's what inspires me, is that it's catching on, that Greta Thunberg said in her speech at the UN, right, these false dreams of that we're going to be able to make all this money is and then what? She was so passionate, and she named it's the economic system, so when you have pre-teens and teenagers talking about a failing economic system, I feel energized, and I feel like we're on the right path.
Great. All right, well, I want to say thank you to each of our panelists for taking the time to be here. This has been great. I think this is the first time we've had this, right? So let's have it again. We need to continue to work to make these links between the workers and the climate. So thank you very much.